Okay, please settle down. Okay, Abhay, shall we start? Okay. 10:45. Fine. Okay. Okay. Good morning. Good morning, everyone. Well, I'm happy to see you all again here, and thank you for bearing with us for last 5 days. I realized this morning that we are already into the 5th day of our course, and that really excites me personally because the way your ideas are shaping up are going to really take us, like much deeper in understanding this wider field of health policy and systems research. So by now, I assume we have got a fair enough idea about what health systems is all about. Today, we are going to look into the other aspect of HPSR, which is the health policy side. So the way I have structured my today's lecture is, we'll start with a brief introduction, try to understand what policy is. Then we'll look into different health policy making cycles, and then end trying to understand or give a deeper look at what the health policy triangle means for us. Okay, to begin with, what is a policy? Any thoughts? Please take the mic, so if you're responding, then everybody can hear what you're saying. What comes to your mind when you hear the word health policy?
Sir, policy is like it's like set of guidelines or protocols. It's not like policy is not something practical. Policy is something like an assumption or theory. So we can implement that through an entity or something called as program. That's what I feel policy is.
Okay. Anybody else? That's fine. Anybody else? Yeah.
Policy is a logical framework of guideline for achievement of intended object.
Okay. Yes, it's a logical framework that guides us. Any final one? Yeah. Correct. It has some kind of a purpose. Okay. So the simplest definition I will give, it's a bundle of decisions. Okay. It's not one particular decision, but it's a bundle of decision. And as one of you have rightly said, a policy may be thought of a system which provides the logical framework and rationality of decision making for achievement of intended objectives. Okay, quite a broad definition, but there are definitely some scholars who have provided us with very interesting definitions, like as Anderson would say, it's a relative stable purposive course of action. There is a purpose behind that action that is followed by an actor or a set of actors in dealing with a problem or matter of concern. Policy is also as the product of political influence, determining and setting limits to what the state does. Well, the last one is something which I find interesting, is like what government chooses to do or not to do. Well, policies could be private or they can be from the public sector. For instance, there could be a group of multinational companies and they might have individual policies for companies in individual countries. A public sector policy may widely refer to the government policy. Sometimes it is also differentiated between a policy and a program. For instance, the government schools health program may include a number of different policies. So, in that case, the program is the embodiment of policy for school children. Now, we are talking just about the policy, but when it comes to health policy, the importance of a good healthcare policy as a determinant to overall health of the population is been widely recognized, widely acknowledged. And if that is so, then my next question is, what do we mean by health policy? Yes, Ajay. Yeah. Correct. Fine. Thank you. Any other thoughts? Yeah.
Health policy, decision, plan, and action that undertaken to achieve specific healthcare goal.
Right. Specifically targeting at healthcare. Okay. Any decisions, bundle of decisions with a major goal or major target of achieving the health goal can be simply stated as a health policy. Okay. But it's very difficult to narrow down to one particular definition in health policy. There are several scholars who have given different definitions. Okay. But still, an interesting one from Walt 1994, it may be concerned with the allocation of scarce resources, the process of influencing the determinants of health to improve health, or the actions of the government to promote health. Another one by WHO. Health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So, it differs from just the policy because we are looking at the healthcare goals. Okay. Now, policies vary. The types of policies may affect the political behavior, and one way of differentiating policies is to divide them into high politics and low politics. Low politics or high politics, when we say. So, when we talk about high politics, it is the macro level policy we talk about. Okay. Low politics are the micro level policies, sectorial policies. And the policy level could be either the national government policy, state government, regional authorities. In the low politics, we will talk about Ministry of Health, local health authority institution, a policy at the clinic level, a policy of a hospital, could be categorized or divided across the health, high politics and the low politics. There is another classification given by Lowy. He talks in terms of distributive policies, regulatory policies, redistributive policies, and constituent policies. So, distributive policies are mostly focusing on allocating resources and benefits to specific groups. Regulatory policies, they are to control and restrict behavior to achieve public goals. Redistributive policies shift resources from one group to another to promote equity. So, there could be a marginalized group and there could be a group which is more privileged. So, whether there is a provision to redistribute the resources so that even the marginalized are benefited from the policy. And constituent policies are those who establish or reform government structures and procedures. Can we think about any health policies in India? Any example that comes to your mind? Okay, universal health coverage, mental health policies, right? Immunization or vaccination policy. Vaccination policy. What else? One Health. What about India's national health policy? Have you ever come across it? Okay. Do you remember this? Ayushman Bharat. We hear about it every often. Pradhan Mantri Jan Arogya Yojana. What is the nature of this policy? Is it distributive, redistributive, regulatory, constituency? Huh? Why it is redistributive?
Yeah, the concept was made at like Delhi at the union level. So then they are redistributing it to all the states. Again, from the state, they are customizing it to state level health policies, and they are adding funds to that, and they are redistributing to that. So it comes under redistributive health policy.
Correct. So it by and large it may be called as a distributive policy, but still in one way or the other it is also a redistributive policy, because it is talking about, like targeting a group, okay, and increasing financial protection to a certain set of population. What about this? Exactly. This is regulatory in nature, because we are regulating the essential medicine prices, we are regulating, like how the prices have been controlled and sort of thing. What is the nature of this policy? It's a mix. Yes, very good. It's a mix. It cuts across all the 4 domains. Okay, it's distributive because it focuses on expanding healthcare services and public health infrastructure. It is also regulatory in nature because it sets standards and guidelines for healthcare service delivery. It is also redistributive in nature, just the example that we saw, Ayushman Bharat. Okay, it is also in one way we are saying it's a redistributive, but it is also constituent policy in itself because it involves governance reforms such as decentralization of healthcare services, but its primary focus is on distribution and regulation. So, rightly said. What about this? Regulatory? Distributive? It's basically a constituent policy, okay, because it refers to the policies that establish or restructure government institution. This policy is about restructuring, okay, it is restructuring, okay, so they replace the Medical Council of India with the National Medical Commission, okay, so that's what constituent policy is. So are we clear now so far? What are the 4 types we looked into? Distributive, regulatory, redistributive, constitutive. One of the smartest batches. Wonderful. Okay, so importance of health policy. It shapes the healthcare system. Do we agree with this? We have been looking into health system, different aspects of health system. We are drawing our conceptual frameworks. Okay, but we need policy, okay, that could strengthen or shape our healthcare system. It addresses social determinants of health. Does it? Yeah. Ayushman Bharat, okay, it will help to address the social determinants of health. Ensures equitable access to healthcare, improves health outcomes, and guides resource allocation on priority setting. We are in this course. by now we have got a clear idea that health policies and health systems are not separate entities. HPSR is a recognition that everything is connected. Okay, so health policies will shape health systems, but health systems will also help us, studies of health system, how to restructure our policies. See, interestingly, there is a book on anthropology of policy where Shore and Wright, referring to Arthur Koestler's book called Ghost in the Machine, they tried to think about policy as the ghost in the machine, the force which breathes life and purpose into the machinery of government and animates the otherwise dead hand of bureaucracy. Interesting, isn't it? So, it also demonstrates the kind of relationship policy and system has, like one cannot function without the other. It's like breathing in the life in the health system. If you don't have a health policy, okay, a health system will, maybe as a structure it will survive, but the functions would be limited, it won't function the way it intended to. Remember, defining policy or healthcare policy is in a clear and universally accepted manner remains a significant challenge. But to put it in simple words, it is purposive course of action, or it could be a product of political influence, decision with a purpose, a bundle of decisions, and collection of ideas. Okay, some references. Let's move on to the policy making cycle. Any idea about the policy making cycle? What are the different stages of policy making cycle? Ever read about it? Okay, identification of a problem. No, you are talking about the research cycle. I'm trying to understand the policy making cycle. You are talking about the implementation strategy now. We'll come to that. That is one aspect of the whole policy cycle you are highlighting. Okay. So when we talk about stages of policy cycle, by and large people will agree that there are 4 stages. Some people will say there are 5. So problem identification and issue recognition. Then we talk about policy formulation. Then we talk about policy implementation, and then policy evaluation. This is the most simplistic form of the policy cycle, but there are alternative explanations, like King Dung will talk in terms of the setting of the agenda, then the specification of alternatives from which a choice is to be made, an authoritative choice among those specified alternatives, and the implementation of the decision. While on the other hand, Hogwood and Gunn would give us a list of 9 different steps which he would think of the policy cycle. So when we talk about these 4 stages of policy cycle, the first one is all about the process of identifying and prioritizing the issues to be addressed. Okay. We gave you a broad idea, and you started working on and trying to identify the key process of prioritizing, like what needs to be prioritized within that problematic situation. Then once you do that, the next stage is about developing policy options and assessing their feasibility. Will this work? Will this not work? Who will support? What could be the barriers? Policy implementation, turning policy decisions into practice. That's the place where most of us are interested in. We want to go and see whether the policy is getting implemented the way it was intended to be. And many times what we come up with is, sir, there is a policy gap. Okay. Policy evaluation, measuring policy effectiveness. Whether a particular vaccine policy that was launched, okay, has it really influenced the prevalence rate? Has it impacted on the community in a certain way? Okay. Whether that policy is a success or a failure, it's the evaluation that will help us answer those. So policy, the first process will help us understand questions such as, like, how do issues get to the policy agenda? There has to be some kind of mechanism. Why do some issues not even get discussed? In the policy formulation stage, who formulates the policy? Okay. how is it formulated? Where do initiatives come from? Policy implementation, often like one of the most important aspect of policy, yet often gets short shrift. What resources are there available? Who should be involved? How can implementation be enforced? And what happens once a policy is put into effect? Is it monitored? Does it achieve its objectives? Does it have unintended consequences? Now remember, policy making is a complex process influenced by various actors, institutions, and socio-political context. And that's why theoretical frameworks help us to understand the process systematically. We need to have some kind of a framework. There has to be some theory, because it might look simple. Oh, there are wonderful these 4 stages. But does in the real world this work in that logical sequence? So there are different frameworks and models. So these are some of the key models of frameworks used in policy making. The stages heuristic model, the incrementalist model, multiple streams model, advocacy coalition framework, punctuated equilibrium, and institutional analysis. I'll just quickly run through it. Stages heuristic, one of the most simplistic models. Okay? It says like there are clear stages: agenda setting, policy formulation, policy adoption, and evaluation. But there is a criticism. People say it's very linear. Okay? It shows as if like one thing will happen and then it will lead to the next thing. Okay? But it does not capture the complexity of policy making. No doubt, this still gives us a broader framework in terms of thinking of different stages of the policy cycle. Then there is an incrementalist model that says that policy is an evolutionary step-by-step process. Decisions are made through small incremental adjustments rather than drastic shifts. So some kind of an alteration, some smaller changes. So the previous policy which is already existing will be the foundation one. It will still be unchanged, but there will be small incremental changes that will keep happening to the policy. The strength, it is more realistic and practical approach, but at the same time there are criticism that it can lead to policy stagnation and resist to bold reform, because if somebody comes and says, no, this needs to be drastically changed, we need a complete reform, but then this model will restrict it. No, because it will go in an incremental way. One of my favorite models is this Kingdon's multiple streams model. He nicely talks about the 3 streams. He says there is a problem stream somewhere, there is a problem stream flowing, then there is a policy solution stream also flowing, and then there is a politics stream. Unless they all come to a window, unless they all strike each other, there is no scope of policy formulation. So there will be instances when the problem and policy will align, okay, but then there is no political will. Okay. Or sometimes the politics and policy will go hand in hand, but then there may be no problem statement available. Or in the third scenario, even it will be the politics and problem. Politicians will be highlighting, okay, there is a problem we need to do, but we don't have a solution. So the action will happen when all these streams come together in a policy window. So what Kingdon says is, I can trace the paths of ideas, but my personal theory is that people plant seeds every day. There are a lot of ideas around and there is no lacking of ideas. The real question is, which of these ideas will catch hold? When you plant a seed, you need rain, you need soil, and luck. Okay. So there are definitely multiple streams, that need to come together. I would recommend you guys should definitely read this paper on agenda setting, okay, by Anushka Kalita and Kevin Crowe. It talks about the politics of health policy agenda setting in India, the case of PMJY program. Very beautifully, they have across the time scale given details about the politics streams, the problem stream, the policy stream, and how ultimately, the policy window try to bring in these streams together. Another framework by Paul Sabatier and Jenkins is about advocacy coalition framework. The policy actors from coalition are based on shared beliefs. So, people will come together. There will be a coalition based on the shared beliefs, and external shocks or policy learned can lead to change. Similarly, you can talk about punctuated equilibrium theory, you can talk about institutional analysis and so on. Just a comparative table to show like different frameworks. So, definitely you will get the slides, okay. So, you can relook at this table and try to understand it. So, remember, there is no single framework that fully captures the complexity of policy making. Understanding multiple theories helps in analyzing policy changes. Choosing a framework depends on the policy issue and context. What exactly are you looking in the policy analysis, or which aspect of the policy are you looking into? Future research should integrate multiple perspectives for a holistic understanding. So, nobody can claim, okay, this is the only model or this is the only theory, or like there are many people who are fascinated by Kingdon's framework. So, they might say, no, I want to apply Kingdon's framework everywhere. It may not work. So, we may need to draw on different theories and framework. And thirdly, coming to the health policy triangle. Have you heard about this health policy triangle? There was an interesting triangle on day one on that group. They had like nicely drawn the patient, policymakers, and what was the third angle? Care provider. Okay. So, this is a slightly different triangle, okay. But the first question comes to our mind is, why study health policy? Is there even a need to study health policy? Because policymakers are already there. They have made wonderful policies, okay. Things are going. Why does it need? Definitely we need to understand who makes the policy decisions. It's all about power. To understand how and why these decisions are made, the processes. To learn about the contents of existing national and global health policies, and to learn how to plan and make policies. And why we need to understand is to better understand and contribute to the change. Okay. Policy analysis is a multidisciplinary approach, aims to explain the interaction between institutions, interests, and ideas of the policy process. Now, policy analysis could be retrospective or it could be prospective. Retrospective, you look at the past policies, try to analyze them, whether the policy was a success or a failure. You are going back, retrospectively you are looking at a particular policy. But prescriptive policy is the prescriptions for policy. That means the policy is not yet been formed. So, we want to plan for a future policy implementation. So, we are doing a study. I am going to give you some examples towards the end of this particular section, okay, in terms of like how prospectively and retrospectively you can look at policy analysis. You can, people also talk in terms of analysis of an analysis for policy. So, when you talk about analysis of policy, the policy in itself is the object of your study, offers an account of the nature and processes by which policy is made. Policy is the object of study. Focus is on policy formulation, process analysis and content analysis. So, out here I would be interested in understanding policy implementation. I would also be interested in understanding how in the first place the policy got formulated, or I might just be interested in understanding the content analysis. What is the content? What are the written things in that policy document? Analysis for policy, focus on the needs of the policy maker and is a form of decision support. Something is yet to be formed. So, our research would help decision makers form the policies. Attempts to provide evidence that influence policy. Okay, this all exercises that we are doing now, we are coming up with wonderful ideas. We are coming up with wonderful conceptual frameworks and we want to go and gather information. So, what are we doing in this process? We are generating evidence and we want this evidence to be used by decision makers to form appropriate policies. Sometimes we may get stuck in whether it should be only content analysis or process analysis. Is it only about what was the policy goal or what interventions were recommended, what was written in the document? No, it is also equally important that we look it into the processes part, like how did the issue get onto the agenda? Did people fight about it? Was there a lot of political cry over there? Okay. Was the political stream very strong over there? Why did change happen at a particular time and not at others? We know a lot of things happened during COVID-19. Okay. We are going to look into that example. Can we explain policy change? And why process is important? Because remember, policies rarely are made on the basis of medical evidence alone. Okay. Most of us are doing wonderful PhDs, okay, and after we do our PhDs, we always want our work to be recognized by policymakers, okay, especially people who work on policy issues. They want their paper, their publication to go as an evidence, okay. But is it the only evidence that the policymaker is going to look into? No. The use of evidence itself is political. Do you agree? Anybody disagree here? Okay. Need for health policy reforms. Prescriptions for policy change abound. And that's why questions remain like, how should reform be carried out? Who will support and who will obstruct? What factors will influence implementation? And when is the best time to introduce change? Okay. So, during COVID-19 vaccine, in one of the states we saw, there was also another vaccine, child vaccine that was implemented. And because of COVID vaccines, all that misconception, people also neglected that particular vaccine. Okay. What happened? Was it the right time to introduce that vaccine? We don't know, because it had an effect on it. So, Walt and Gilson gives us this very interesting framework called as the policy triangle to do any kind of a policy analysis. They talk in terms of the 4 interrelated components: context, content, process and actors. So, context could be political, economic, social and cultural environment. Yesterday, if you recollect Karina in one of her slides, she has already started talking about the various forms of context. Content, the actual policy, the laws, the regulation, the strategies, the process, the policy making stages. Actors, it could be individuals, it could be groups, organizations and institutions involved. Let us look into the context component. There is a useful categorization of factors by Leacher. He talks about factors, that factors could be situational. So, within the context there are different factors he is talking. There could be situational factors, there could be structural factors, there could be cultural factors, or there could be external factors as well. For example, in situational, more or less transient or idiosyncratic conditions which may influence policy. There could be war, there could be a drought, COVID-19 pandemic influencing emergency health policies, India's rapid vaccine rollout. The situation was so much terrific at that time that we had to take fast decisions. Structural, relatively unchanging elements of the society, political system, economy, or even the religion as a system could have a structural component. Cultural, the value commitments of prevalent within the polity or system, vaccine hesitancy and traditional medicine preferences in various countries. External, so somebody may be interested in understanding only the context component and say, okay, what happened when in the implementation process, like how did context influence this whole process, and then he or she may want to look into these factors. The content component, describes the actual policies, their objectives and their components. So, basically what is the content of the policy in itself? What are the goals of the policy? What mechanisms are used? Is it taxation? Is it talking about the regulation? People out there were talking about the regulation of private sector, for instance. Are there any subsidies? Okay. Are there any incentivization that is happening? Okay. For Ashas, for instance. Okay. What does that policy talks about? How is equity and access addressed? In your case yesterday, you were talking about the access part, whether the RTA policy also touches upon the access issue, whether the content, whatever is written material is actually addressing those things. The process component. The process component is all about the stages of the policy cycle. So, it could be agenda setting, it could be policy formulation, it could be the implementation, or it could be the evaluation. So, somebody using the policy triangle may say like, I want to just use the implementation part and understand what has happened after the implementation stage. So, just to give some more slides on implementation. So, health policy implementation is the process of turning policy into practice. So, there is a policy and there are practices, and many times we see there are policy practices, gaps are there, and our studies contribute to understand why those gaps are and can be feedback to policy revision. So, policy implementation often involves three types of methods. One is the top down approach, that as you said Ajay rightly in the beginning, the bottom up, okay, and the principal agent approach. There are different definitions, like policy implementation encompasses those actions by public or private individuals or group that are directed at the achievement of objectives set forth in a prior policy decisions. Analyzing policy implementation, people can take a top down perspective or they could be a bottom up perspective. From a top down perspective, implementation is a rational process. It is very hierarchy controlled. Somebody sitting at the top, he has laid down the policy, and implementers are told that they have to abide by the policy guidelines. They have to follow the way it is meant to be. It is very hierarchy controlled. It is pre-planned and controlled by policy planners. Policy is an independent variable and more deductive in nature. You know, sometimes we say in a day-to-day conversation, it's a very top-down approach, okay? Because as implementers or as people in the department, students, we may say like, no, principal's decision or HOD's decision is very top-down. He is not talking to us, okay? He is not considering what our challenges are. But vis-a-vis, bottom-up perspective thinks in terms of implementation as an interactive process. There is a local autonomy. Implementers often play an important function. Policy is and dependent upon interaction between actors at the local level, and it is essentially inductive. Okay. You know, like what happens at the traffic signals. If you are not wearing a helmet, how much fine we have? 500 rupees. That is a policy decision. Okay. Also a law enforcing. Okay. But what happens if you do not pay 500? There is a different policy that is prevalent over there. Okay. You will immediately put your hand in the pocket, and so the policy implementer, the person at the traffic signal, the traffic police, what he will do is like he will implement the policy in a different way. There will be a subversion of the policy. Okay. And in that light, there are different models or frameworks or theories. One which is widely famous is the street level bureaucracy that Lipsky talks about. So, Lipsky describes implementation of policy as highly influenced by the street level bureaucrats. That is the frontline staff who can change policies significantly. Not to say, but sometimes you know, like in departments also, okay, people who are on the front line, maybe the non-teaching staff, okay, they will turn the policies, okay, they will handle certain things in a very different and an innovative way, okay. So, these frontline people are the actual implementers of the policy. Similarly, Elmore will talk about backward mapping process, where knowledge and problem solving ability, incentive structures and bargaining relationships are seen at various level. Similarly, implementation structures, and Barrett and Fudge will talk about policy and action as a negotiation process. Okay. So, there is a policy cannot be regarded as a fix, it is mediated by actors who operate and implement. So, they will meditate it, there is a negotiation process constantly going on, and they will implement it. So, this I talked about street level bureaucracy. An interesting paper, quite an old paper, but a very interesting paper to understand how, like frontline workers in any kind of a health setting, okay, respond to the policy changes and how they alter the policies. So, this was one of the papers like we read long back. We are bitter, but we are satisfied. Nurses as street level bureaucrats in South Africa. So, even in all of your problem analysis that you are doing, the conceptual framework, think in terms of who are those frontline people, who are the actual implementers, okay? And how will they change or modify or subvert the policy. And the fourth component within the policy triangle is the actor component. Individuals and groups basically who influence the policy decisions. They could be state actors, they could be non-state actors, NGOs, private sector, donors and civil society. International organizations like WHO, World Bank and Global Fund. On the very first day, your group gave us a very nice overview of the way they had drawn their diagram. They started from WHO and they came till the periphery level. They showed us the different levels of actors as they understood the health system. Okay. I borrowed this slide from the Keystone one. So, actors are state specific actors, ministries and bureaucracy, non-state actors, okay, civil societies, interest group, actors who may contribute on the both sides, networks and street level bureaucrats, okay, who fall within the state actors and they are the one who are the actual implementers of the policy. Why use the policy triangle? Helps in understanding the power dynamics and political economy of health policies. Useful for policymakers, we researchers and stakeholders in policy analysis. Applicable across different health systems and income settings. Now, using policy triangle, if you do a retrospective analysis, you can pick any particular policy. You can see like if there is a policy around RTA, or if there is a PPM-TB policy over there, or what does the digitalization of ASHA, is there a policy document around it, okay? And do a policy analysis, see what the content is saying about it. What were the stated, unstated aims, what were the level of fees, various services, context, economic, ideological, cultural circumstances, actors, who are the main actors involved in it. Processes, be it top down or bottom up, how was policy communicated, how was it implemented, did it reflect original plan, or how is it getting implemented at the moment of time, the digitalization of ASHA, for instance, you might think of, or even the CHOs sitting out there. What has happened with their new positions in the system? A very familiar example, like a recent thing that we have all faced. We have gone through this pandemic time, and we know, like there were a lot of emergency decisions that were taken. If somebody is more interested in to understand, he can apply policy triangle in understanding the India's vaccine rollout. What are the context factors? Global pandemic, economic crisis, health systems, strain, content, health financing, vaccine policies, processes, emergency decision making, international conditions. Okay. And within that, how governments have worked, what WHO role WHO played, private sector, vaccine manufacturers, various of the different companies. Okay, every now and then when vaccine production was happening, okay, the news were flooded with All these interactions, what did government deal, what was the deal going on, who was overpowering, what were the decisions and so on. So somebody can relook at it and try to analyze it retrospectively. Using policy analysis prospectively, as I said, for instance, India doesn't have a vaccine on respiratory syncytial virus. So one of the studies that I have been engaged with is trying to look for a prospective policy analysis for launch of respiratory syncytial virus in India. So the content, what are the components and cost of the policy? Will it be a burden to the system? An additional one more vaccine within the existing pool of vaccines? Context, will it be a national or we want to make it state specific because maybe a particular state might have a high prevalence, or it could be a local policy. Importance of RSV in the population. Are there any other country policies? Can we borrow, can we think of? How are vaccines perceived in the population? What is the discourse around PSV? Who could be the actors? Who will support this policy? Who will resist? How to neutralize? Who can resist this kind of a policy? Sometimes parents as stakeholders can say, कितने टीका लगाओगे हमारे बच्चों को? How many times will you prick? Okay. So there have been concerns from the receiver side, from the beneficiary point of view. People have showed concerns in this study that, okay, we are worried about the multiple pricks, that what they would call. Processes, how is public health policy made at country level? So what is the ideal way, how India looks at, okay, the policy framework? Are there paths for compromise? So during COVID-19, we have seen that. So prospectively, can we also think about some of these aspects? Benefits of policy analysis, rich explanations of why and how policy outcomes were or were not achieved. Tools to make future policy designs and implementations more effective, and strategies to improve policy outcome. I think this is my last second slide, linking it back with the HPSR thing. If some questions we need to think through, or even the questions that you are working on, now that you have submitted those questions, I know you don't have time to revise them, but you can think about it. How does a new healthcare policy impact access to care for marginalized populations? What are the unintended consequences of policy change on healthcare delivery? How can stakeholder engagement be optimized to ensure successful policy implementation of PPM, for instance? What are the cost effectiveness implications of a proposed health policy? And so on. So you might need not think only in terms of policy, but you can link up the policy analysis in terms of the wider health systems framework. And finally, to conclude, health policy is vital for healthcare systems. Policy making cycle ensures systematic decision making. Policy triangle aids in policy analysis, and continuous evaluation is essential. So that's where I can stop my presentation, and I hope you have got some idea in terms of like what health policy is all about at the end of the day, and within the HPSR framework, how health systems and health policies are not separate, but they are tied up to each other closely. So if you have any other questions, we could definitely take up those questions during the tea break or during the lunch time. But now I would like to pause here. Yeah, we'll stop here and we'll take a break for 5 minutes.
Okay, so welcome back. I hope that the inputs into health policy were interesting and stimulating. And I hope that, I think Solomon has already said that, you know, seeing the intricate connections across policies and systems is very important, because a lot of the research that we're doing in HPSR is looking at the failure, actually, or the gaps in terms of implementation of policies, or policies that are somehow at a mismatch in terms of actually addressing what the system needs. So I just wanted to say that I've looked at your research questions, and I'll shortly be sending some feedback. And what I found very, very interesting is that the conceptual frameworks, so some of you took a bit longer to get to your conceptual frameworks than others, and some of you were very fast in terms of grasping what had to be done. So those who were fast with grasping what had to be done weren't necessarily as strong on the questions, whereas those who took a long time to do the conceptual framework were actually a little bit stronger on the questions. So I'm not shedding any light on overall performance. Overall was very, very good. Okay, so you'll see that there's very, very few red boxes, in fact, and I wouldn't worry too much about them, but I thought it was interesting because it was different than what I expected. So that was interesting. All right. Okay, so now we're going to move to a fairly practical session in some ways, and we're going to be doing a little exercise just to support this stage that you're at. Okay, so we've now moved into the questions of how you look at policies, policy documents, and how you conduct policy analysis. And I have to say that I'm not a policy person, I'm not a health policy person, I'm much more a systems person. So my interest has always been at the interactions that take place in the system, even though I recognize that, you know, a lot of my work is concerned with understanding how systems implement or don't implement certain initiatives. But people who are strictly policy analysts are operating at a kind of different level. They are operating at that macro structural level in terms of understanding kind of very broad level questions around how do things get onto the agenda, yeah? How are policies formulated? As I think Solomon showed you, the policy cycle, how are they implemented? And what is the post-policy phase? And that's something I have experienced, certainly in my career, in different places, but you know, most recently probably in South Africa, where we were looking at the extent to which a policy on decentralizing care for people with multi-drug resistant TB was being decentralized down to the district level. And we were looking at the variability across the country because there were no really strong guidelines for implementation. So the policy came in, but people kind of had to figure out how to do it themselves. And so we looked at 3 provinces, and we were trying to understand how actually providers and managers cope up with that situation where they don't have very clear guidelines, or rather they might have some guidelines, but given their specific circumstances or constraints, they may find it more or less challenging to implement them in the way that was intended. Okay, so it was an evaluative study, but it was using a realist approach. But what I was most interested in is to look at what I would call adaptive responses. So the frontline providers, how were they going out of their way to try to provide decentralized care? And we wrote up a paper which I'll share with you, which is all about these adaptive responses in policy implementation. So we're going to look at document mapping and review. That's not super exciting because you probably do it on a routine basis anyway. You know, this is probably one of the methods you're most familiar with because it's the most intuitive in some ways. We all, in the course of our studies, we look at different kinds of documents. Usually we're looking at published literature, but maybe a smaller number of us are looking also at other types of documents, okay? So when I say other types of documents, with respect to health policy and systems research, what do I mean? What other types of documents are worth looking at? Guidelines, yeah, what else? So obviously draft policies and policies, yeah, guidelines, but what other kinds of documents would be interesting to capture the flavor of what happens at that deliberative level, that higher level, what else would you look at if you could get access, let's say in an ideal world? Emails or meeting minutes? Absolutely, yeah. Meeting minutes, very good, yeah. And we mentioned another source recently to capture the tone of the public, the mood of the public. What would you look at? The media, yeah. Okay, don't ignore the media. The media is actually very interesting. As long as you think about it as media, don't think about it as truth necessarily. But in some ways, even when we look at policies, always remember that at heart we should be, in policy research, we are constructivists at heart. So nothing is truth, okay? Everything is a version of truth or a version of reality, and you're trying to capture what underlies, what assumptions underlie the way a specific reality is presented, okay? So document mapping, review, we're going to talk about mapping actors and stakeholders, and then we're going to talk about a very specific type of interview that is often used in health policy work and also systems work. So you should be able to learn how to map relevant documents and actors that are pertinent to a topic, and we'll go back to our topics just to be consistent. We will be able to identify key informants for an HPSR study. You should be able to identify the difference between a regular interview and a key informant interview. And there's a lot of confusion about this, lots and lots of confusion. And you should also be able to identify and use strategies that will ensure a high quality key informant or elite interview. And we're going to talk about the difference between key informants and elite informants. Okay, so starting off with document mapping and review, why documents? Yeah, this is again very constructivist point of view. A document is not just a piece of paper. Yeah, it is imbued with some kind of meaning, because the person who produced that document had an intention. Yeah, they had an intention. They're trying to convince you of something. They're trying to represent evidence in a certain way, and they're trying to inform a situation, or they have the intention to change a situation. Yeah, so it's not a standalone object, but it should be understood in the social web of meaning within which it's produced and consumed. Okay, so always think about what is the intent behind the document, and how is it expected, what consequences is it expected to have in terms of the target audience that it's for. So documents, both policy and non-policy, we generally review them for different reasons. We want to understand or describe the content or categorize the approaches. So do you remember when we talked about the differences between positivist research and descriptive positivist research? We said that you could do an analysis of a document simply by counting the number of words that refer to something. Okay, that's quite descriptive, because you are assuming that the more often a word is used or a term is used, the more important it is in the document. That's a kind of fairly basic analysis, is just literally running through documents with a search, a search function, and saying count the number of times collaboration or partnership or words that are similar to that are mentioned, because that will help you locate in what ways partnership is being defined. What exactly do they mean by, in terms of a PPM, what exactly do they mean by partnership? Yeah? So you could search through those documents just by counting how often it's mentioned. You can also examine the implementation of health policies in real world settings. So you might not be looking at the policy document in that case, but you might be looking at guidelines, you might be looking at those meeting minutes, and you might, let's think of other things. There might be other kinds of documents that are used at the lower levels of the system, which are some kind of policy implementation guidelines. You're trying to situate policy agendas within specific contexts. Let's say a global policy comes in, so AMR policy, and you say, we actually know that this is being understood and implemented quite differently in different countries. And I was talking to Sakshi yesterday, and she says it's implemented quite differently across different states in India as well, or sometimes not implemented at all yet. So what is the lag in terms of implementation of a common policy across the country? What explains the fact that in some states it gets quickly onto the implementation track, whereas in other states it's still at the stage of being formulated, right? The other thing is to analyze the policy process. So, you know, where are we in the cycle? And you also do a document review because you might be commissioned to inform a new policy. And this is when people realize the policy is outdated, we have new technology, we've got better means of screening, better treatment regimens, so we actually need to inform the formulation of a new policy, which is going to improve whatever the situation is. So this is taken from a paper that was published a few years ago in Health Policy and Planning. And Health Policy and Planning is a journal you should be familiar with if you're interested in policy. It's a very, very good journal. And it basically has this nice series of articles from time to time, which are called How to Do or Not to Do. Yeah? So how to do or not to do a stakeholder analysis, how to do or not to do a document review, how to do or not to do some sort of method. So if you look it up, you'll find a very, very useful compilation and synthesis of literature on a specific method, usually pertinent to policy or systems research. And it also gives you tips, quite practical tips. So it's one of the few rubrics within this journal that is pragmatic, it's practical, yeah? So in terms of your documents, this is a bit standard, so forgive me, this is a little tiny bit boring, but you're going to ready your materials. So this seems obvious, but maybe it's not that obvious, because you need to be very clear about the boundaries. What is it that you're going to look at? Again, anything that you're going to get access to versus not access to is defining your universe of documents. And that universe might be quite restricted, simply because it is difficult to gain access to. You can gain access to the things that are published, yeah? You might even find Ministry of Health websites publish draft guidelines. But the ins and outs of what happened in these meetings and who was taught, who were the main people and how did the discussion take place, it's going to be more difficult. And often it's very sensitive, right? Because people don't really want to show you that actually very little evidence went into this policy, or very little discussion, or very little consensus was there. But basically, in an ideal world, if you really wanted to get at how did this policy get onto the agenda, you would love to have access to people's accounts or actually some documentation to show you the process. So you're going to set parameters around the nature and the number of documents that you plan to analyze based on your question. And now this obviously goes back to the questions that you all have set, because you've all set some macro level questions. So you might want to revisit your questions and think about the fact that your question you need to be able to answer the question with what is available, okay? Now obviously in your case, we're almost going for the optimal questions, the ideal case scenario. Are you really going to be able to access, funding allocation or budgets for XYZ? Probably not. But I want you to keep that at the back of your mind, that when you formulate a question at the macro level, be aware that it's going to be constrained by the number of documents you can that are publicly accessible or accessible to you through whatever connections you have, and the kinds of interviews you might be able to conduct. So conducting research at this level can be more difficult than conducting it within the system or within the community, simply because people at that level are often make themselves a bit scarce, or they're simply busy, right? But back to the documents. So you need to think about how much time you're going to allocate to the document analysis and what's the scope of your research question. So time is an important issue, because we often, in any research project, we all include something that says document analysis, because we want to familiarize ourselves with the topic. But actually, if you do too quick and dirty a job of it, you don't really get much out of it. It's actually a fairly dull exercise. So in a lot of the projects that I've been involved in, we have included a research objective, which is to create a policy timeline of the evolution of XYZ policy in XYZ country. Yeah. So for example, the recent work in Uganda was trying to understand and compare the way the country had implemented policies for infection prevention control in the case of multiple recurrent epidemics. So not just COVID, but Ebola, and prior to that HIV, and now of course there's other epidemics going on. So Uganda is a country that often experiences epidemics and endemics. And so what we were trying to understand is the country, the response in terms of infection prevention control, are they learning from previous epidemics? Yeah? And in order to do that, we needed to first use documents to create a timeline to see how is IPC conceptualized, what spheres does it cover? Is it mainly looking at health facilities or is it looking at communities as well? Who seem to be the main actors and does that change? How much funding is allocated over time and does that change? So we were looking at trends, yeah? So that's where the timeline idea came in. But actually the exercise turned out to be much more time consuming than we expected. Because it wasn't just a question of putting down dates and creating a timeline. It was actually trying to understand the discursive shift. And by discourse, I mean the ways in which IPC is conceptualized discursively. So discourse means in terms of how people give meaning to certain concepts. Okay, and you can imagine IPC for HIV looks quite different than IPC for COVID, because COVID was a global pandemic. HIV was global too, but it also had very specific national level policies, especially in countries that were extremely high burden, like Uganda. Okay, so you're thinking about the time you have available, and you have to be realistic and maybe trim down the question. Because if you think, okay, my first phase, first 6 months of my project, I'm going to do some review of documents. Just be clear what you want out of that document review. And then you need to establish criteria around the specific topic that you're investigating. So creating a policy timeline is a descriptive activity, but in terms of the actual thing that you want to extract from the documents, please do not be vague, okay? So I want to understand how, I mean, in two of your topics, you're actually looking at collaborations, right? You're looking at PPM as a collaboration across sectors. CHO is an integration of a health worker that has to sort of interact with the rest of the health workforce. So you might say, I want to understand the extent to which policy documents, how do they reflect, represent, and conceptualize the notion of integration or collaboration, yeah, or digital literacy, yeah? That already homes it down, because you know, I'm going to look at these documents and I'm going to see what exactly do they mean by digital literacy, what was intended, okay? And did that change depending on multiple iterations of the policy? So your topic, a particular policy, program, health issue narrowly defined. And the second is dates of inclusion. Now this is important, right? In Uganda, it was important for us to go all the way back to the 90s because we wanted to see how the notion of IPC had changed depending on the epidemic that was of most importance or significance at the time. But you might say my timeline is much shorter. The digitalization issue has only been around for X years, and therefore my timeline is just the last health policy period. I'm not sure if that's the case, whether it's 10 years or 5 years. But you think about the time period, that should be specific to your topic. And then you also, in terms of planning, is you start to make a list of places where you are going to locate those documents, because that is going to determine the validity of your question. If you realize that you can't actually access most of the things you'd like to access, put it aside. Think of something else that you can do, okay? So one of the things we wanted to do in Uganda was we wanted to understand how public perceptions of personal protective measures were changing. And we realized that they archived a few major national newspapers, but we realized that we had allocated far too little time. So by the time the person had located that there were 4,000 plus articles, we thought, no, this is an impossible task. It could be interesting, and there could have been a way to maybe, you could have divided it into time periods and then selectively chosen some. But we just didn't end up doing that. So I think, always this reality check. Does it match to the topic? Is it giving me something specific, and can I do it? Is it feasible within the time period? Okay, so this is taken from the article, and this just actually gives you a list of different types of documents that you might use. So official documents, and they tell you, what counts as those official documents, implementation documents, legal documents, working documents, scholarly work, media and communications, and other. Now, this is kind of interesting. Why do you think scholarly work is there? Because you might say, that's not really a policy document. Why do they put scholarly work there? So scholarly work refers to published literature, right? Why would you include published literature in a policy review? Yeah.
Published literature has the primary work done using primary data, where the researchers have gone in the field and collected the data, studied the data, and mainly it has policy recommendations based on the analysis of the data. So
okay, good. Okay. So can you formulate a question for me that asks exactly that, but asks it in a neutral way, rather than assuming that research informs policy? Anyone? How would you ask that question? Yeah? Go ahead. Let me ask it this way. Do you think all research informs policy? Do you think all policy is evidence-based? Okay. So that's an assumption. So how do you phrase it as a question?
Like, is this result could be made as a policy?
Say it again, is the results what?
Is the research can be made it as a policy? Like, some research is done already. Like, and there are some results in our entrance I got from the student.
Yeah.
Now we can think that can we make it as a policy? Like, can we new policy, or can we add something to the existing policy?
Okay, yeah, good. I agree.
Also, adding on to what she said that research delves into primary data and how was policy perceived at the grassroots level, and then with that evidence, sometimes policies are informed. So when we're asking a question in a neutral way, maybe we can frame it in a sense that how does the community respond to an X policy?
Okay, we're not talking about the community now. So my question to you was, why, if you're a policy researcher, would you be interested in published research? It's not a policy document, it's published academic research. So normally that's part of your background, right? But I'm saying it is a form of data in this case. Why is it a form of data? Okay, think about what Solomon referred to, forms of evidence. What kind of evidence is this? Okay. Okay. In the best case scenario, we would hope that policies are evidence-based. Okay? And evidence comes through, ideally, rigorous, robust research. All right? So the question is, can I review research to see the extent to which my topic, whatever it is, PPM effectiveness or digitalization, to what extent does research on the topic feed into policy? Okay? So it becomes a different exercise than doing a literature review, because you are very specifically looking at who commissioned the research, why did they commission it, and were the results taken into account at all, especially if they were major studies, were those published results taken into account in those policy documents? Okay? Because in an ideal world, we would hope that research informs policy. We know that it doesn't all the time, not necessarily, but you need to consider that as one form of evidence that may or may not have played a factor. So when we did the study on decentralized care in South Africa, we not only interviewed people who were important and influential at the level of government or NGOs like MSF, but we also interviewed researchers, academic researchers, who were associated with specific papers that had proven, that had shown, yes, you can decentralize DRTB care. You don't have to do it at a highly specialized level. We have done a trial to show you that a nurse is able to deliver this care. So we wanted to know, did that evidence from those trials, from that academic research, have any place in the actual policy formulation? Okay? All right, so that's why you have scholarly work over here. Okay? Media and communications, again, different types of media and communications. You can probably, I can barely see this on my screen, but you can probably see it a bit better. Something else which I find interesting, textbooks and other course materials or training materials. Okay, let's pretend we are a policy researcher and we want to review medical textbooks. In what kind of situation might I be interested in the content and the curricula of medical education? What would that shed light on for me? Yeah? Okay. Yes, could be. Could be. How well it's okay, up to guidelines. Okay, but which policy are we talking about? What kind of policy here? I want to review medical textbooks. I want to review the curriculum. Okay, I want to choose a time period. When were textbooks for medical education in India last revised? I don't know when they were last revised. But what am I interested in? What's my policy question?
To what extent the textbook has taken the new curriculum?
Good.
Like if it is a CBME curriculum is there.
Yeah.
So whether the textbook reflects that curriculum or not.
Very good. Okay. So the issue is that you might be interested in changing policies on medical education, right? And you might say, your hypothesis might be, is that the way that medicine is being taught in low and middle income countries is not meeting the needs of the country. So I had a PhD student who did this in Nigeria, and he basically was starting from the argument that in Nigeria, especially at the time that he was doing the PhD, there was a severe problem of brain drain. So all the medical doctors were primed up on high-tech medicine because they were all primed to leave the country and work in the US or the UK. Okay? So he looked at, and he did some interviews to assess to what extent the quality of medical education and the actual curriculum was suited to doctors serving in their own country, which it wasn't. So in fact, the whole medical education system, plus the family support system, plus the whatever other structures, was pushing these guys to leave the country. So very interesting. It was an interesting topic. I also did a PhD examination of AIIMS, the institution that you're from, in Delhi, which was about socialization of medical doctors in AIIMS. And it was again about the, it was a very excellent study. I think she published a book which would be really interesting. Her name is Anna Ruddock. And she was looking at the kind of the policies on selection of medical students. And so she was looking at the criteria and how the criteria had been changing across the country for entry to medical schools. So she was also looking at, selection criteria, the examination system, the curricula, what happened at each stage. And she was reviewing, things that were where you might think, well, this isn't really policy analysis, okay? So think creatively, yeah? Always think creatively. Think about the full range of documents that are going to shed light on policy, and in a broader sense, it's on politics, isn't it? Policy as politics in some way, because it signifies a kind of political change or shift in terms of how we're looking at a particular theme. Your second step is you're going to, now that you have your time plan, okay, you've decided on this is my time period, this is my available documents, and this is my question. That's very important. Your second thing is you're going to have to come up with some idea of how you're going to extract data, okay? Because you are treating a policy document or a research paper as a form of data. So this is very different than summarizing them. You're actually looking at it and you are thinking about it in the same way as you would an interview, a transcript, yeah? So the method of data extraction really depends on the research question, whether it's descriptive, explanatory, and also the nature of your documents. So for example, often what is commonly used is some kind of spreadsheet, like an Excel sheet, where each row is a document and each column has a category of information that you would like to extract. But this assumes what? This assumes that you have already some idea, some theoretical idea about what it is you want. It has some assumption about what different aspects of the document, what different content is going to reveal to you about changes in medical education, or key actors in terms of shaping decision making, or key events, or whatever it is, yeah? But your question is operationalized and dictates the columns, the material that you're actually going to extract systematically from the documents. You can also import documents into common thematic coding software like Atlas TI or NVivo or whatever they're called. You can do that. I personally am not a fan, somehow. It's because I'm old school, right? Probably generation-wise. I still, when I used to have to code any kind of document or transcript, I still used to use highlighters, Post-its, cut the thing up, move it around, because it felt like I was more immersed in the analysis. I think that the more we use technological support, including our move towards AI, the less capable we are ourselves of being able to do things in a way that is deep or thoughtful. Okay, that's just my my rant for the day. If the research questions focus on process, you can use the documents, as I said, to compile a timeline or to trace processes across time. What is also very interesting to do in a policy analysis is to understand, for example, if it's a comparative analysis, is that you might have some kind of flow chart. So what were the main factors affecting decisions, that led from X to Y? And you might be comparing kind of a decision flow, whatever, decision-making flow chart or something. How can you organize the data in the most coherent manner? What are your priority categories? Because you don't want to have too many columns, otherwise it becomes unwieldy, okay? So it's always a balance, like it is for any kind of qualitative analysis. It's a balance between too narrow and too broad categories. This is why the conceptual framework is very helpful, because I've been telling some of you, you've got to club these things together. You've got to club them, consolidate them, or chuck them out, yeah, because they're less relevant. And the third thing is you're going to analyze the data. So obviously data collection and analysis are iterative. So you start, it's that cycle, again, the research cycle, whereby you start to look at the findings, you're starting to eyeball your table, you know, just like you would in quantitative analysis. You're starting to see trends and patterns are starting to emerge. And the same thing happens when you do this kind of analysis, is you're going to see things that lead you to other things and will inform, you know, where you obtain further data and how you interpret it. So you're starting to analyze data. Often you're annotating, you're making notes on initial theories, and you're potentially modifying the document selection criteria. Because, for example, you read a document and you realize that when we did the work on the decentralization work, we realized that the most important actor pushing decentralized care was not a government actor, it was an NGO. It was MSF, which is Médecins Sans Frontières. So they were so active in one province of South Africa in terms of pushing innovative models of integrated care, decentralized care. And because one of them was very good friends with somebody else, they actually came somehow into the policy-making sphere, which was quite interesting in one state, not necessarily in another, in one province. Okay, so when you look at individual documents, you might be assessing different things. So I explained that one thing is using an Excel sheet, but the first thing you might be doing before you do the Excel sheet is you look at each document and you try to summarize. Who was it written for? What was the purpose? Yeah? What was the context of this? Okay, it was written at a time when everybody was uncertain, or it was written at a time when the epidemic was in full-blown phase, and therefore, you know, the tone is quite different, sense of urgency. So what's the motivation? What was the agenda? Who was involved? Always check who's behind the document, who is mentioned more frequently. How are the issues being framed? And what is the use of sources and evidence? So this is what I would call a descriptive summary for each document that you include. Okay, this actually comes before the extraction, the matrix. Okay, so overall, I think it's important when you describe the methodology for this document review is that you make some notes. You know, how easy or difficult is it to locate these documents? Because later somebody might say to you, oh, but you completely missed out X, Y, Z. And then you can say, yes, but it was impossible to get a hold of that. So you are already in the process, you're already safeguarding yourself because you're noting the limitations of what you can and can't do. Yeah? Which voices and perspectives are represented? Which ones are missing? So for example, the student I had some years ago, Solomon knows her, she did some work on the uptake of pentavalent vaccine in India. She was looking at the policy-making process. And we knew that there was a big lobby, anti-vaccine lobby in India at the time. I don't think she adequately captured those perspectives, simply because it was difficult for her to get them on board, because by this time the thing had already been launched and they sort of faded slightly in terms of their importance, and I think people weren't willing to speak so much about it, okay, even though it was very important at the time. So you need to acknowledge that. How complete is the set of documents? What's missing? You're also comparing, as I said, content, style, format, how long are they, what's the tone? Is the tone directive, telling people what to do? Is it consultative? Is it responding in a kind of, how do you say, defensive way? Yeah, you get a sense of that. Is visual information used, and how is it being used, okay? So we're always thinking about the use of evidence. So documents that have a lot of quantitative tables or graphs, or always think, put your critical hat on, yeah? Because don't just accept and swallow things as, okay, this is evidence, this must be true. Look at the graph, look at it carefully. What is it trying to tell you? What argument is it trying to make? How is it supporting what the document is telling you, okay? Any difference in framing and interactions are also interesting, okay, because then you get a sense of the network. Who is colluding with who and who's conflicting with whom, because the documents may cross-reference other actors. And then there's differences in how specific topics are addressed across levels or types of documentation. So for example, if you're looking at policy documents, the policy on medical education is looking very good, but when you look at the textbooks, they haven't really evolved, yeah? Versus the perception, the media perception of medical education in the country is quite negative. Okay, so you might have a mismatch which you need to try to explain. The fourth step is to distill your findings, and the question for you might be, where do you stop? Yeah, I think that's why the plan in the beginning is very important, is clarify upfront what you think you're going to be able to do within what time frame. Usually you have, you try to recognize early on what kinds of documents are relevant to my topic, and have I adequately touched on all those types of documents. Sometimes it's saturation, because to be honest, it's sometimes extremely boring to go through multiple government documents. They're just they're not exciting reading. So you will notice that some of them are saying the same thing, so that's called saturation, right? Time issues, obviously. You synthesize findings, you might use some descriptive visuals, as I said, timelines, graphs, or actor mapping. We're going to talk about actor mapping in a minute. You might group your results just like you would with qualitative data according to themes. You might present your results as a narrative or a policy brief. So when Solomon Abai and I worked on the same programs that were funded through the British government, we were often requested to develop kind of short and punchy policy briefs based on the work that we had done on the private-public sector involvement in TB control or on integration of care. So people are less interested in a classical, here's my 30-page paper. They want to see something that's 2 pages, crisp, and that's interesting, right? And you also want to validate your findings against other methods, because what's in the document might be quite different than if you actually interview the Minister of Transport or whatever, right? Good. So we are going to, not going to do this now, we're going to come back to this. This is an exercise that we'll come back to. But we're going to move straight to what's known as actor mapping. So now we're moving away from documents, but actually the documents have already given us some clue about the relevant actors, because they're authors of the documents, or because they're mentioned, or you have some sort of organogram, or whatever it is, yeah? So actor mapping is simply a visual depiction of key organizations or individuals that make up a system, including those who are directly affected by it, as well as those whose actions influence the system. So in some ways, your conceptual framework is also going to help you with that. Because you're going to look at it and you're going to say, okay, who's the actor behind this? Have I only got ASHAs, or are there other things that are important? Because if I'm looking at my meso and my macro levels, there are other people, other actors, or structures that have bearing on what's happening in terms of their digital literacy capacity. So how does actor mapping support systems, mapping support systems thinking, including an HPSR? Because it gives you a good sense of the context. It allows you to explore connections. Connections are often not neutral. Yeah, the connections might be friendly connections, they might be conflictual or contrasting connections, and so on. They might give you a sense of information flows, who communicates with whom about what, yeah? They might help you determine where is the hub of power. On paper, there might be a sense of consensus across a broad range of actors, but once you've done the analysis, you realize that most of the decision-making takes place, at this level. And it also helps you gain a sense of contrasting perspectives. So this is an example, a stakeholder map for climate change and health in England. So at the time of writing this paper, I think it is from around 2 or 3 years ago, 2021, the public health landscape in England is undergoing significant change with the announcement that Public Health England will be removed and the roles divided between existing and new organizations. In particular, the new UK Health Security Agency will take over responsibility. So this is a simple kind of organogram, but it is mapping out the relevant bodies, regulatory, advocacy, education, and others, to this topic of what's happening and who is relevant for making important decisions in this climate and health space. Okay, so how do you identify key actors and stakeholders? Usually your documents are your starting point, okay, but I'm assuming because you're interested in the topic is you already have an idea of who the key people might be. You might have identified them from the literature because you realize they are prolific in terms of writing about the topic, or from the organizations that the literature represents, or, as I said, from your document review. So strategic plans, evaluation reports, etc. That's the core of your map. But you want to expand the map beyond what you know at the outset of the study, which is often limited. So which people or places do core stakeholders interact with on a regular basis? Which organizations are supporting or influencing those who are interacting at the core? Which ones are holding opposing or alternative perspectives? Very important to make sure you take account of them. What types of local, regional, national, or international organizations influence the core's experience? Who is funding these people? Who is conducting relevant research? And who actually sets policy? So these are all just examples of prompts. Yeah? Okay, so we're going to push on for another 25 minutes or so, and then we're going to move in the afternoon into an exercise that covers some of these things. So you have done your document review, you have identified some important actors, and you've tried to map them in terms of their influence on your topic. Now you're going to go out and do your study. Yeah? So how, beyond document mapping, you're going to be doing some interviews. And what you may have already, you might be familiar already with a key informant interview or an elite interview. Let me ask you, why does a key, or what do you think, what does it sound like? What does key sound like? A key is something that opens a door, right? So what's the difference between a normal interview and a key informant interview? What do you think? Is there a difference? Let me put it this way. Okay, why is there a difference?
A key informant is the one who is the holder of the information in that particular setting. It is different from the normal interview because whatever information we want to extract from the key informant is not available with the local person available over there. So they basically opens the door for us to inquire certain topic of which they had information rather than the other person who can give inputs on the same information.
Okay. What characterizes a key informant in contrast to a regular informant? You said that they offer an entry point. Why do they offer an entry point? Why are they different from a general informant?
In the key informant interview, we are going to get, it's not for it is not only restricted to or can be used to the, the providers are not for those who are using the whatever is going on healthcare. We can get the perspective of both the side, and also the word key means it's something what we are going to unlock. It's not like a general interview, we will go round, again come to the point. It's not like that. Here it's like key informant may be a semi-structured questionnaire or something like that. We are going to take something which we actually want from that particular person. That's what the key information makes sense to that. It will add some strength to our, previously we did 2 exercises, what is called, we are going to, first we will go through the documents, then from the documents, we are going to find the key, stakeholders. So from the stakeholders, we move beyond that. We want to know what exactly is going on for to
Okay.
extract that, to elicit that, we can do this.
Okay, sort of on the right track, but not quite. Okay, so I'm going to ask you it differently. Go ahead.
He is the representative of a particular community whom the researcher can interview to understand the views of the community he is representing.
Okay, okay. All right, let me give you an example. Let's say you want to understand, you know, the relationship between traditional birth attendants and state-sanctioned, whatever it is, auxiliary nurse midwives. Okay? Who might be a key informant in a study that is looking at the relationship between these two types of birth attendants? Mothers? Okay, do you agree? You're allowed to say it depends. Okay, any idea? Okay, the study is about midwives, yeah? Traditional birth attendants, community-based midwives, and facility-based midwives. Is a community-based midwife, could they be a key informant? Okay, why or how?
It depends on the type of question we are probing. If you are probing them for how do they function, so they are the best one who can tell us about their story or how they actually function in the system. And we can compare it to the ANMs as if how do they function. So they both are the one.
Okay, okay, so that's the clue. You're giving me a clue here. It is they are the best people to give me information on how something functions. Okay? Probably lots of midwives could do that for you. So what is special about the key informant midwife?
The one who is practicing it for a long period of time,
Yeah.
one will be the key informant for this case.
Okay, good. So it has something to do with the length of experience, the specialized knowledge, yeah, and maybe does seniority have something to do with it? Should I be choosing a key informant because they're positioned high up in the hierarchy? What do you think? Is it better for my key informant study for me to go to the senior A&M in the facility versus a more junior one? It depends, right? Absolutely, it depends, okay? Okay, so what I'm trying to say to you is don't assume that leadership or hierarchy is naturally associated with being a key informant, okay? Because sometimes that leads us to a very tricky situation. We think that just because somebody is a designated leader or a designated superior in terms of the system, that they're going to be a key informant. But now imagine this situation. I'm going into health facilities and I want to understand how managerial practices around a specific topic are influencing people's motivation to follow some sort of guidelines. And I say, okay, who's my key informant? Of course, I go straight to the clinic managers. Go to the clinic managers. This situation happened to us, and we found that some of the clinic managers are absent most of the time. Okay, so we have facility managers with a high level of absenteeism. Why? Because they're gone on trainings, or they're doing their private practice, or whatever it is. So they're not ideal key informants because they don't actually know very well. They know how things are supposed to run on paper, but they're not really so informed on the in and out, the runnings of the clinic. Okay? So don't assume hierarchy or leadership translates into a key informant. Don't assume that. Let's look at what they are. Key informants are people who can unlock information for you about a specific issue. And they're usually specialized in terms of their in-depth knowledge, their familiarity, or their experience on a topic of interest. So when I was asking you about the A&Ms, we're not necessarily looking for a senior A&M. We're looking for somebody who has a lot of experience. But what else? We're looking for somebody who's willing to talk about their experience. Because a key informant interview, you're going to see, is very different from a normal interview. It is a dialogue. It is not a classical interview. It is really a dialogue where you yourself have to be aware of your positioning. But it is not the question answer that we're familiar with in terms of a normal interview. Yeah? That key informant that is selected should be able to provide what's known as a broad interview overview, so a bird's eye perspective, but also specific detail. Now, a bird's eye perspective means that they're capable of a certain level of abstraction. Okay? And sometimes it's difficult to find people with that analytical capacity. But a really good key informant is somebody who has analytical thinking. They're able to analyze trends. They're able to tell you what has changed, why things are the way they are. And they're able to look at structures within the system that they're operating and tell you more about, you know, interrelationships or dynamics or whatever. So they are specialized in terms of their area of expertise. They are experienced, but they also have this level of thinking, which is slightly different. Very often, we don't just speak to them in the beginning of the study, but we try to come back to them over the course of the study. Why? Because our ideas change. And you want to go back and you say, look, I've done my survey and I'm finding some really strange trends. You know, can you comment on this? Do you think this is unusual? Or so it's nice if you can go back to them, right? It's also often somebody who can help you with further context. So in the beginning, you might have an idea. I've got some 5, 6 key informants. These are people who I think will be helpful, but very often we ask them, we say, is there anybody else you think that can provide this kind of level of detail or overview? When do you interview them? You interview them when you need inside knowledge about a policy, a process, an outcome. And when the knowledge about the topic is not accessible to the public. It's privileged knowledge, okay? It's privileged because they hold it in their way of doing things or their way of thinking or whatever. And often you also do it when there's not that much time and you need to get immersed into a topic fairly quickly. You can use it at the outset of a study in an exploratory way because you're exploring the field, but you can also use it to gain depth. So there's nothing wrong with doing key informant interviews later in your topic to gain some kind of historical context or, you know, ability. Let's say you did the document review, you did your timeline, and now you want to go to the key informants to represent specific eras. So you go and speak to some retired people, yeah, people who are important in the government. Retired people are excellent to talk to. Why? Because they have shed all the worries about the power dynamics. Yeah, if you talk to the current minister, he's going to be very uptight. He's not going to give you a lot of information. You talk to a retired minister, oh my God, they will tell you everything, everything and anything. So you're also trying to gain breadth and perspective through different kinds of positions and multiplicity of knowledge. So we generally talk about 3 types of knowledge that we're gaining in a key informant interview. The first is technical knowledge, yeah? Because let's assume you are looking at a new technology and you're trying to understand, you know, we mentioned the example of GeneXpert, but let's imagine we're even further along with some diagnostic technology. And you are a lay person, you don't really understand much about how the technology works or how it's going to be implemented. So you need a key informant who's going to break it down for you very clearly. What does this technology involve? What is the infrastructure required? What kind of equipment does it look like physically? Where is it going to go? So you want technical knowledge, you're exploring that area. What does implementation of this new diagnostic screening machine, how is it going to impact on the health system? And the first thing you want to know is what is it? Yeah? If you don't know much about the thing itself and what it's meant to do, it's not a good starting point, right? So you want to explore that technical knowledge. The second is process knowledge. And process knowledge is about understanding how processes are standardized or formalized and put into place in such a way that is intended to, whatever it is, improve workflows or improve the structure of care or the organization of care. So your next informant in terms of the screening machine would be somebody who tells you about how it's being implemented in the facilities. And they're going to explain to you the process, the algorithm. What is it being used for? When is it being used for? What is the decision-making flow? Yeah? And the third one is your key informant, who might be able to give you knowledge on why things are happening the way they are. So it's a higher level person who has a good oversight. They have been overseeing or they're responsible for rollout of this technology in multiple districts or multiple states in the country. And they are going to give you some insights into why it seems to be more acceptable in some places than others. Why is the uptake better in some places than others? Why is the budgeting, you know, whatever the question is. Now, you might be saying, do I need separate key informants for each of these? Or are there key informants who might be able to help with, you know, the first two types of knowledge versus the last or whatever? Of course. Your key informant topic guide can include questions about the three of this, but obviously sometimes for technical knowledge the person is quite different than very often they're completely different, because the technical person is so hyped up about their technology that they're not really thinking about implementation that much. Right? Okay, so as I said, what type of knowledge? Technical, specific knowledge in the field, often details on operation, laws, etc. Process is about the routines, the interactions. The expert has knowledge as she or he is directly involved in this. And the explanatory is their interpretation of the rules, their interpretation of the relevance, their interpretation of what's happening and why it's not happening. Also reveals things like their own ideologies, inconsistencies in ideologies. And the interview, him or herself and his routines are the focus of the interview. Okay? In this case, the technical knowledge, you're not really asking, and what do you think about this screening machine? No, you're not asking about that. You're asking them, what is this machine? What does it do? You're not asking their opinion about it. Yeah? Versus here, you are asking, you're much more focused on the informant. So you have been involved in this nationwide program to improve screening of cancer, X cancer. Tell me about what you think. You know, did the implementation of this machine make a difference? Why or why not? You're asking their opinion versus the first one where you're just asking the technical, what is this? How is it going to work? Okay? Any questions on that? No, okay. So the next question is how many informants? It really depends on the purpose of the interview. Are you exploring? Are you trying to explain? It depends on your mapping of actors, relevant actors, because you might need to explore contradictory positions. It depends on, are you able to access them? You might have a lovely wish list of 20 key informants, but actually access is going to be only feasible for half of them. The timing, do you want to have a study where you come back to them regularly? The scale of the study. And I personally, whenever I see a key informant study with 200 interviews, I say, I'm sorry, sir, or madam, that is not a key informant study. Okay, because it's a key informant interview is very big. It's a big interview. So I usually look at, for small studies, 8 to 10, maximally 12. And for bigger studies, kind of anywhere in the range of 20 to 25. Okay, so this is just an example. Study from South Africa from many years ago. This was about integrating SRH and HIV services as an important policy concern, especially in high prevalence, HIV prevalence settings. Obviously you know this, history of vertical program resulted in SRH being handled differently from HIV. And they had a lot of challenges to integrate care in South Africa. So they interviewed 21 key informants. There you can see the types of key informants. They used purposive selection and snowball sampling, which means they asked people about other people they should interview. And they basically sampled to redundancy, which is effectively something like saturation. Semi-structured topic guide. And the interviews were face-to-face or telephonic, audio recorded or transcribed. And here you can see a little bit the results that they came about. They looked at policy and systems challenges, service challenges that resulted in, this is another conceptual framework, by the way. Not a brilliant one, I have to say. It's too many things clubbed, too many things in the things, but essentially they were looking at why there's a failure to integrate, right? But they're also looking at opportunities to improve the situation, okay? Now before we close, let's talk about one more type of key informant. So sometimes you have a key informant who holds, and in this case it is an issue of power or authority. They're a recognized powerful person. And they're usually a lead representative of an organization or a profession or a decision-making structure. So they're on the top of the organogram. And they can be responsible overall for the development, the implementation, or the control of the particular intervention or the strategies you're interested in. They have privileged access to information about groups of people or decision processes. And the reason why we are doing this is an exercise that Solomon will do with you, I think on Monday, which is that when you start to map the actors and how they're connected, you realize that some actors seem to be more important than others. Yeah? They're the kind of elites in terms of that all information flows via them. Yeah? So this is some sort of network analysis, and there are quantitative techniques to do network analysis, but we're doing it in a kind of much simpler way. We're trying to understand the relative weight, power, and influence of specific actors versus others. So who are these experts? They have high insight in aggregate or specific knowledge. They know a lot about processes, behavior strategies. The information is difficult to explore through other methods. They're often part of a network. In fact, they're often at the center of the network. They can lead to other interviews. They're often highly motivated. So whenever I've had to conduct expert interviews, they know they're experts, right? They're very happy to speak to you, usually. Okay, now we're going to talk about something else which is very interesting, which is your role in a key informant interview or an elite interview. Because it's a special kind of interview, it is challenging if you have limited knowledge about the topic, because you're dealing with somebody who is important or thinks they're very important, and he's going to tell you, I've got exactly 10 minutes. What do you want to know? Yeah? Or they're going to basically tell you what you already know. Yeah? Because somebody at that level, you would have read the policy documents and you say, okay, so I've read this, and they will just spit out exactly the same thing as in the documents. Because they're bound by certain rules, so they work for some organization like WHO or whatever, ministry, and they're not really allowed to go outside of that, okay? Or you have the awkward situation, which is, okay, if you don't mind, I'm tape recording this interview, tape record, very dull interview, everything. Okay, now turn the tape recorder off. Okay, now I'll tell you what the truth is. Now I'll tell you what the real story is. That happens all the time, is that people will talk off the record and they will happily share, and then you're like, what do I do now? According to ethics, I'm not allowed to take this into account. So I think you've got to make that very clear, and we'll go into ethics and ethical strategies in HPSR in, I think, middle of next week. You've got to make clear how you're going to handle that kind of situation. Do you still use that information? If so, how do you use it? How do you inform the person that you nonetheless, despite the fact that they switched the recorder off, what are you going to do with it? All right? So this happens quite a lot. So let's think about what your role is. So there are 4 potential roles that you have as an interviewer. Sometimes you are a so-called co-expert, yeah? So that means you are yourself, let's say you're a researcher, let's say Solomon, okay, not Solomon, but let's say that you are somebody who is a researcher who's been working on, looking at comparing effectiveness of different screening technologies for a long time. And you're interviewing somebody who has come up with a new screening technology, which is a bit controversial. But you already are quite, you're pretty good in your field, right? They know you're good in your field. So it's like and like, yeah? So you're both rubbing each other's backs, yeah? Your knowledge level is comparable. The communication is symmetrical because there's an acknowledgement side, either explicit, oh, hello, doctor, yes, a doctor, so and so. I mean, that all that social stuff that goes on when people acknowledge subtly or unsubtly acknowledge that they're on the same level. The interviewer knows the terminology in the field, so the style of questioning is much more open. It's like a dialogue, and the interviewer plays an active role because they're able to direct the conversation in a way that is really picking up. They understand the topic. So when we were doing this work in South Africa, one of the interviewers was himself a medic who had worked in TB care for a very long time. So when you compare those interviews with other interviews where the person was a lay person, didn't know the field very well, very, very different. I'm not saying one was better or worse, okay? But the person who was already an expert in the field took a lot for granted. So they just went straight to the technicalities that they knew about, or they mentioned names that they knew about. So obviously it has an advantage. Very good level of discussion, information generation. You get past all the superficial stuff, less issues with balancing power dynamics. Now, what is the disadvantage? Is that you're going to stay within your framework of the field of expertise. It tends to be over-focused on technical detail and lacking broader context. Why? Because these are two experts talking to each other. So they're going to be like, oh yeah, what did you think about, when they added this, blah, blah, blah. And you're like, for an outsider, this is completely irrelevant to our broader topic, right? Okay, now you have the opposite situation, complete lay person. The interviewer has a low level of knowledge of the field. The communication is going to be asymmetrical. The interviewee may dominate. So you're facing somebody who's going to assert themselves because they realize that they're the ones in charge here. And the interviewer has a perceived lower status. So the interviewer ends up asking fairly broad questions because they don't know the field well enough, which generate long answers or generate answers which you could basically gain from the policy documents already. Yeah? So the advantages are the interviewees have a high level of confidence. They may be at ease with this position, and they're under pressure to explain. So sometimes there is an advantage if you're a lay person because you're allowed to ask the so-called dumb questions, right? So tell me how this machine actually works. Sorry, but I'm not from the field, so just explain it to me. And then, listening to that, you can say, but how is that going to work if the electricity is cut half the time? How are you going to do that? Oh, we put in a generator in place. Yeah, but does this facility actually have the financial capacity for the generator? So you can see how asking sort of simple questions might lead you down a track which allows you to ask questions that are about the broader context of implementing this technology, where the first two, the co-experts, just ended up talking about the technicalities of the thing, right? The advantages are, the disadvantages are that the interviewer may struggle to engage with the interviewee answers and can't guide, so they end up kind of reading off their sheet the whole time. Yeah, okay, oh yeah, sorry, question 3, yes, what did you think? And it ends up being, it's not a dialogue, right? It's just question, answer, yeah? So remember, key informant interview is a dialogue. It's not, it's very much guided by the responses. Okay, another type of role is an associate, where the interviewer and the interviewee share the same frame of thinking. The communication might focus on shared experience. The style is informal, and the relationship is collegial. Yeah, doesn't mean you're an expert, but you are kind of still at an equal level, even though your field might be different than this person. So the advantage is there's a high level of trust. You get access to confidential insider information because often you're, for example, working in DRTB care. So when you work in health systems and policy work, anyway, the field becomes smaller and smaller. So basically, if Solomon or Abai or I go to an HPSR conference, we kind of know half the people already, right? Which means we're all associates, right? There's a collegial kind of understanding, oh, we're all part of this little community, right? So trust, you have access to confidential insider information. Why? Because they'll reference things like, oh, did you hear that so-and-so left WHO and they've now moved to London? Really? Is that true? So what happened? What's the story? Yeah, it was terrible. They were stuck in this position, they couldn't do this, and there was a huge fight between so-and-so and so-and-so. And so you're like, oh my God, yeah, I know that guy was, so you get into this whole kind of insider chat. Yeah? Not very professional, has to be said, but it happens. because you're in the know. The disadvantage is it's a normative framework. The assumptions are not questioned. Confidentially shared information may actually present a breach of ethics. Yeah, if you start getting into chat. Yeah. Now your fourth position, an interesting position, is you're actually a critic. So the interviewer and interviewee have different views and frames of thinking. The communication may reflect this. The style of questioning tends to be a bit provocative. Okay, let's say you are talking about the topic of vaccines, uptake of vaccines, childhood vaccines, and you're going to have to interview somebody who represents the anti-vaxxer lobby. Yeah? So you're going to go into the interview, you have to stay very, very neutral, but some of the stuff that this person is telling you, you just are finding it very difficult to hold back. You know, are you aware that measles is killing so and so many? So you've got to hold back, right? Even though this person is saying, why? You know, we all had measles when we were young children. What's the big deal? It is self-immunity, natural immunity, et cetera, et cetera. So you really get that kind of views sometimes that you fundamentally disagree with. So the advantage is you're going to get somebody who's challenging the status quo. They're going to give you a very different perspective, and your job is to really understand the arguments that underpin their point of view. Yeah? It's an elaboration of the normative stance, and it's unpacking the assumptions that we would normally have around the normative stance. The disadvantages is the dialogue can be disrupted. The interviewer may compromise their position and their access to further informants because they end up in such a disagreement that the interview doesn't really go all that well. And I think I have been in situations like that where it becomes quite tense because you represent a certain view, they know you represent a certain institution, and so on. Okay, so I think we're going to stop there. I think our next session is going to be quite practical. We're going to go into conducting key informant interviews. I'm going to give you some tips around them, and then we're going to go into the exercise of mapping documents that are relevant to your topic, mapping actors that are relevant to your topic, and developing an actual key informant topic guide. So you're going to choose categories of people that are relevant for your topic, and you're going to come up with, individually, you're going to come up with some guides that you're going to exchange on. Okay? So we'll stop there.